Good evening, everyone. Welcome back to You and Your Health. We're excited that you're able to join our program this evening. We have a very special guest on today's program with an important topic. So please definitely do share the link so that others can also benefit from that discussion. So if you're watching the program for the very first time, my name is Cora Rabbits Hilton, the co-host of this program, and I have two other co-hosts, Dr. Edward Asuma and Dr. Yvonne Pulampudov. Hi, Dr. Eddie.
Hi, Ruka.
Hi, you two. I know we had some system issues, and so we apologize to those of you who have tuned in. Sorry for the late start. So we're just going to go ahead and get started, and then we can chat in the back end. Thank you. So as you know, this evening's discussion is on how to lower your prescription costs. Due to inflation and costs of everything, prices of almost everything has increased, and so has prescription. So our guest certainly came at the right time, and we are grateful that she accepted our invitation for the program. So Dr. Sandra Amorin is a board-certified clinical pharmacist with over 16 years of experience in pharmacotherapy drug monitoring in a variety of clinical settings, including both inpatient and outpatient settings. Dr. Amorin received her Doctor of Pharmacy degree from the Long Island University School of Pharmacy in Brooklyn, New York. As one would expect, she excelled in her education and graduated summa cum laude among the top of her class. She currently serves as a senior supervisor in pharmacy at the George Washington University Hospital in Washington, D.C. Prior to her current role at GW, she served as a clinical staff pharmacist at the United Health Group in their Pharmacotherapy Management Center in Elk Ridge, Maryland, where she performed telephonic pharmacotherapy consultation with patients, including comprehensive medication reviews for Medicare and Medicare members, which is one of the topics that she'll be discussing this evening. She also served as a clinical staff pharmacist in several medical centers, including the Anne Arundel Medical Center in Annapolis, Maryland, and at the Kent County Hospital Center in Brooklyn, New York. In addition to her current role at GW, she serves as a clinical staff pharmacist on an as-needed basis at the Adventist Fort Washington Medical Center and at Kaiser Permanente Capitol Hill in Washington, D.C. Dr. Amorin is also a queen mother in her homeland, Ghana, in the Gomoa East traditional area. Her queenship name is Nana Aba Ife the First. So she's probably going to correct me. I know she told me that 100 times. I'm probably still messed that up. She's also a wife and a mother. She's actually married to my brother, Mr. Sylvester Opong, and is a mother to two children, Nolan, and got my goddaughter, Amy Marie Opong. So let us welcome Dr. Sandra Amorin to the program.
Hello, good evening.
Good evening. I almost changed your name as usual.
Yes, yeah, that will be discussed on the back end.
On the back end.
But thank you very much for the invite. This is long awaiting, I know, but this is the time that my schedule has allowed it, and I'm very honored to be featured on this program to talk about this all-important topic that everybody's interested in. I'm interested in it too.
Yeah,
So
thank you again for coming. So if you're ready, Dr. Eddie, do you mind projecting the slides for Dr. Amorin? You should be doing it on the back end. So how should we refer to you as while we wait for Dr. Eddie? Do we call you Nana?
Well, since we are
Nana Bahima.
Let's see, this is a sort of a professional environment. Dr. Amorin works just fine.
Dr.
Amorin works just fine.
Dr. Amorin works just fine.
So I'm excited to finally be able to come on this show to also share my experience and, share ideas with our fellow Christians, church members, community members, friends, family.
Yeah. We're excited for you to come as well.
Everybody will be able to take home something.
Yeah. Yeah, definitely.
So
It's certainly definitely important topic because everything has gone up, right? Prices for
um,
food has gone up. Obviously, everybody talk about gas has gone up, and
COVID.
medications have gone up as well. So here we go. If we can
Here
have
we
the
go. So again, my name is Sandra Amorim, and I'm a pharmacist, and I love being a pharmacist. I really do. So this is very exciting for me because I get to talk about something that I love doing. So before I get started, Dr. Eddie, can you project the disclosure slide for me, please? So I don't have anything to disclose. Any information that I present, I have no ties with any companies or any products that will be discussed in this presentation. Next slide, please. Okay, so I decided to give a little bit overview of Medicare before we get into the prescription cost savings, only because Medicare is a big part of healthcare. A vast majority of our patients are seniors, and even our church members, a lot of them are seniors, 65 and over. So I just wanted to give a little bit overview because my prior to my current position, what I was doing was with an managed care insurance company, we call it. So I dealt with Medicare patients a lot, and so I tend to gear towards them when it comes to prescriptions and healthcare in general. So when we say Medicare, what is Medicare? Basically, Medicare is insurance for people who 65 and over, and is run by the government through the Social Security Administration. So basically, when you are 65 years old, you can actually sign up 3 months before you turn 65 because it takes a little bit of processing, paperwork, and everything to get it done. So if you are planning on retiring before you are 65, 3 months prior, you can put in your paperwork. So you could get Medicare before you turn 65 if you have certain conditions. For example, if you have any disability like ESRD, end stage renal disease, which is basically um, kidney disease, which has progressed to a certain stage, and also ALS, which is a muscular disease, which is a autoimmune disease that affects the muscles. So the patients cannot move and they are basically immobile. So you can sign up for that before you're 65. So there are parts of Medicare. We hear Part A, Part B, by C. It gets very confusing for a lot of people. Even healthcare professionals do get confused.
yeah.
So I thought it wise to just break it down a little bit to my audience, and so I have a better understanding of what it means. So Part A basically is hospital insurance. When you sign up for Medicare, you go to the hospital, they use Part A to cover. So any kind of long-term care, hospital, nursing home, rehab, all of that, home health, it covers also. So any kind of inpatient certain, that's Part A. Then Part B is what you use when you go to the doctor's office. That's Part B. And also you can use that outpatient for DME, which is durable medical equipment. So canes, wheelchairs, hospital bed, walkers, all of that, that falls under DME, and that is Part B. Then Part D, that's what we are interested in. That's the drug coverage. So when you sign up for Medicare, you automatically get the Part A and B from the check, the portion of the check that the government takes out, Social Security takes out. But you have to sign up for Part D if you want the drug coverage. So that's where the general insurance companies come in. You can sign up with the healthcare, Caremark, this and that. So that is Part D drug coverage. Next slide, please. There's also another one that's called Part C, which is Medicare Advantage. That's a little bit different because that is just like getting insurance from your employer. So this is something, a private um, plan that Medicare allows for people to put everything together. Because when you're on the job and you sign up for insurance, you have your medical, your dental, and your prescriptions all in one. So this is kind of how it is. So they call it bundled plans. So you get A, B, and Part D with this Medicare Advantage, and it has a little bit of added benefits to compared to the original Medicare, because this one gives you hearing aid benefits, dental benefits, and vision benefits, which original Medicare does not provide. So that's the difference. Next slide, please. Okay. Now, now that we talked a little bit about Medicare, I want to go to the drugs. So prescription drugs. We're going to talk about how to save when you get your prescriptions. So how are prescription drugs prices set? But who regulates it basically? So fortunately or unfortunately, they are not regulated. Nobody regulates them. So if a drug company manufactures this drug, okay, they bring it out. Regular pharmacies usually they get their medications from wholesalers. For example, Cardinal Health, McKesson, Amerisource, they are all wholesalers. So they are like the middleman. So whatever the middleman bought the medication from the manufacturer, they decide to add whatever it is to it, and then they sell it to the pharmacies, and then they also in turn sell it to their patients through prescriptions. So you can go to CVS down the street, and then you go to the Target, you go to Walgreens. Everybody has a different price. It's very interesting. It's a free market. So I'm marketing my medication. I'm selling it for this price. If it's okay for you, you get it or not. And then insurance companies right now, over the past 10 years, their premiums have increased tremendously. And so they're not really covering a lot that they should, which they did prior to that. And so a lot of patients are not able to afford their medications because a lot of them are not on the formulary. Formulary is like a list of preferred medications that each insurance company has. So you go to the pharmacy and they tell you it's not covered. That's what it means. It means it's not on your formulary. So that's what that means. Next slide, please. So before I go into reducing the prescription cost, I wanted to talk a little bit about cost of healthcare in general. So from a pharmacy standpoint, when a patient gets discharged from the hospital, they get a prescription from their physician that they have to fill outside, continue to take it, that will prevent them from coming to the hospital. Now, if the patient is not able to afford their medications, which means they are coming right back to the hospital, readmissions. And guess what? Readmissions drives up the healthcare costs up the roof, especially if it's within 30 days. If a patient leaves the hospital within 30 days and they come back, the healthcare institution usually eats up the cost unless in certain conditions. And so, as a pharmacist, the patient being able to afford their medications when they leave the hospital, it's so very important. We cannot stress that enough. So when we go in and do discharge counseling for patients who are being discharged, one of the very first things that we talk about is, can you afford this medication? We make sure that your insurance, it's on your plan, working together with a care coordinator as well as the social worker to make sure that this medication that we are giving you to take outside, you can actually be able to afford it. Otherwise, you're going to end up in the hospital, healthcare costs going up, up, up. And post-COVID, it's unbelievable, the cost of
Mm-hmm.
healthcare. So we want to do everything possible to prevent the patient from coming back to the hospital for readmission for the same exact condition because they could not afford their medication. So I know we have prescribers here, MDs, MPs, PAs. Please, when you're prescribing these new meds, please make sure that the patient can afford what you're prescribing. Otherwise, it defeats the whole purpose. They're going to be right back where they started. So these are some of the ways that we can reduce cost. Generic equivalent of cost, 90-day supply, mail order pharmacies, and I will go into details more in the later slides. Next slide, please. Okay, so generic drugs. We've all heard what generic. What is a generic drug? So basically, when a company manufactures a medication, which is the first company to manufacture, usually we call it a brand name. So after a certain time, the FDA gives them something called a patent. I don't want to go into it too much, but that gives them a certain number of years for them to market their drug post um, release. That way they can make all their money back, recover profits and losses and everything before they allow other companies to manufacture it. So those are the generic that come out after the original drug, the legend drug, which is the brand name drug. So, what is a generic drug? How do we define a generic drug? And this, according to the United States Pharmacopoeia, I know it's a big word, and all it means USP. I'm sure everybody has read a bottle of a prescription or OTC, which is over the counter medication, that says it contains such and such amount USP. That's what that means, United States Pharmacopoeia. And what is the United States Pharmacopoeia? It's just a publication that contains legally recognized standards to identify the quality and the purity of packaging and labeling of the medication. So according to this, the United States Pharmacopoeia, a generic drug has identical amount of the active ingredients in the same form, which is apples to apples, to tablets, injection to injection, capsule to capsule. So it should have the same form, the same standard of strength, the quality, the purity, and the the same amount of chemical ingredients as the brand name. For example, atorvastatin, brand name is Lipitor. I'm sure everybody has heard Lipitor before. It's a one of the medications used to manage high cholesterol. And so when we say atorvastatin and Lipitor, from the medical standpoint, they are the same. It's just one is brand, one is generic. One came out first, which is the Lipitor, and then afterwards, the generic comes out. Now, the generic drug has to perform the same in the body as the brand name. Otherwise, the FDA will not release it into the market. So the question is generic as good as the brand name? Yes, according to the FDA, which is the Food and Drug Administration, which is the body that regulates all medications that come on the market, prescription medications that come on the market. So if the FDA says generic is equivalent to the brand name, that's what it is. It's exactly the same. It's just manufactured by a different company. And we usually call it AB rated, which is the healthcare professional. They'll say AB rated. That's generic equivalent. So what I'm saying and what, according to the FDA, generic is as good as the brand. Now, I know people are thinking about questions, and I'm going to ask the questions on the next slide. Next slide, please. Okay, so if they are just as good, why did they cost less? The question that everybody asks. Why is this $100 and this is $20 for $30? Why the difference? Well, two reasons. First one is when the companies manufacturing the drugs, the generic companies, they compete through price, right? It's like you are selling here, we are selling the same things. And so I have to make sure that my price is good. That way you can come to me rather than go to my neighbor. So that makes the generic medication, because a lot of companies are producing the same drug at the same time, the cost cuts down tremendously. So you can get about 90 to 80 or 80% cost difference between the generic and the brand. So that's where the competition brings the differences in the prices. And then the second reason is that before a medication comes on the market to be released, they have to go through clinical trials. And this could take years and years of research. So the brand name company has already done all this work, gathering all this research information. So when you want to duplicate a drug as a generic drug, you don't need to go through all that again. And so the generic company doesn't put in as much to do any clinical trials whatsoever. So that's how come the cost of the generic drug is much, much, much lower than the brand name, because they don't have to do all these trials that the brand name company has already done. So that's the difference. Next slide, please. Okay, now the first cost saving program that I want to talk about is Good RX. It's been on TV, on the radio, it's very popular. So now, what is Good RX? It's a prescription discount program that is free to customers. You don't have to be a member, you don't have to sign up. All you do is, for instance, my doctor has prescribed a medication for me, and I'll use atorvastatin, which is the Lipitor. Well, all I have to do is go online, goodrx.com, search for my medication, put in, oh, I'm sorry, my battery is running low. I have to charge it. I thought I was sorry.
Sorry. It happens to all of us.
Okay. Let's see.
You were describing how they can go on the website to
Make
obtain
sure that
that
it's in
discount.
before I go off. I
Okay.
apologize. Give me 1 minute. I thought this was in. It's not charging.
It's not.
It's not charging. Let me make sure it's charging.
Okay. Okay, can you turn the camera off for a second?
Yeah.
Okay.
Okay. It's good now. Okay, I'm good now.
You good?
Yes, sorry about that.
That's okay.
Oh, okay. So you go online and you search for your medication. So atorvastatin, you put in the strength, which is I chose 40 milligram tablets, and then you click on. Dr. Adi, can you go back to the previous slide, please? Yes. So you just have to click on lowest price. Find me lowest price. Once you click on that, there's a list of all the pharmacies that are associated with GoodRx, and it's most pharmacies, like most major pharmacies, CVS, Rite Aid, which is Walgreens now, Target, everything. So a list will come, will show up, and it will have every pharmacy that shows up. It will have a different price. So CVS might have a different price compared to Target, compared to Giant. So whatever you are comfortable with and whatever is in your neighborhood or whatever is convenient for you, you just choose that and the coupon will pop up and you can, next slide, please. You can clip the coupon or, so this is how, the one on the left is the coupon. The one that says Giant Pharmacy, $13.91. That is, so which means I chose Giant. So if you chose CVS, the price might be different. So every pharmacy, depending on what contract they have with GoodRx, comes up differently. And this is huge savings, like huge savings I can get with this GoodRx. The one on the right is like a prescription drug savings card. It's like an insurance card. So you can actually request on the website for them to send you a card looking like this. And then you just take you to the pharmacy and the pharmacist will process your prescription with this card like an insurance card. So this is something you can request the hard copy in the mail and they will bring it to you and you just add to your insurance card. When you go to the pharmacy, meanwhile, you've already searched for your drug, right? So you know it's going to cost less than your insurance. Then you use this one.
Okay.
This is how this works. Now, GoodRx a lot of times provides you with less than the cash price of the prescription. So if you did not use your insurance, and a lot of times when you use your insurance, the price may be coming up higher, only because most of us have plans that have deductibles, which means you have to reach a certain amount out of your pocket before your insurance kicks in. So you go to the pharmacy, you pay for you pick up your prescription and they will tell you this price and you tell them, but I have my insurance, and they will tell you it's your deductible. That's what it means, which means you have not reached the limit that you have to spend as a consumer before your insurance kicks in 100%. So while you are waiting for your deductible to go where it's supposed to be, this is what you can use. So I personally have used it before. You just have to go online, search for it, and see what amount you are getting. And you compare it to what your insurance is giving you, and then you choose the best price. So you can still have your insurance, all right. You just have to tell the pharmacy, whatever the cheapest price, that's what I want. So this is how this works.
So a quick question. Does all the pharmacies accept the GoodRx?
I would say 90%, maybe 100%, because it's a very popular one. So when you go online and you search for the name of your medication and you search for find me my lowest price, Every pharmacy that's associated with it will pop up, and then
Okay.
you choose. And these are all the major pharmacies, all the major retailers accept Good RX. Next slide, please. Okay, I've already answered this question. If you have insurance, you can still use this one. You just have to compare which one gives you a better price. And most of the time, if you are not past that deductible stage, your copay probably will be more than what you would pay if you use Good RX alone. So you just have to compare, you know? Yes. Next slide, please. Okay, so now I know somebody's already thinking about this question. Okay, nothing is free, nothing is free. So how do they make money? Well, they don't require you to be a member or anything like that. They just want to give people discount, and they make their money through advertisements and referrals from their websites. So that's how they make their money. So it's a free service to consumers. Next slide, please. The next one that I want to talk about is Cost Plus Drug Company. This one is fairly new. I think it's only maybe the beginning of the year. It's fairly new, but it's making waves already. Now, this was established with the goal of bringing transparency to the consumer, basically letting the patient know how much we purchased this drug, how much we bought it from the manufacturer, and we just want to add a little bit of percentage to it, and then we tell you how much we're charging you. So this drug company, and it's an online pharmacy as well, it does not include, it cuts out the middleman, which means they don't have any wholesaler. They buy their medications directly from the manufacturer. And they have a team of people that negotiate directly with the manufacturers of the drugs. And then on the next slide, I'll show you how the calculation is done. So the this comes especially helpful to the patient when it's a new medication or it's not on their formulary or something that is very expensive, cancer medication or something that is outrageous in price, because buying the medication directly from the manufacturer, they get huge discounts. So they're buying it at wholesale price instead of getting the middleman to get the medication from the manufacturer and then selling it to the retailer, and then they sell it to the consumer. So they get the prices directly from the manufacturer. And then what they do is they put a 15% markup price. And when you go to the website, all this information is there. So they will buy it directly from the manufacturer. So they buy it at a huge discount because it's direct purchase. And then they'll add 15% to their price, which keeps their business going. And then you're going to add the pharmacy fee, which is $3 per drug per order. So each prescription, if you have 5 prescriptions, each one you add $3 to the price of that, and then shipping and handling based on the destination of the final product. So this is how it works. It's an online program as well. Next slide, please. So how to get started? This you have to create an online account. You go to costplusdrug.com, and then you create an account. It will ask you for your medications. It will ask you for your doctor's name, and you can contact the doctor directly and get your prescriptions, or you can ask the doctor to send in your prescription to them. And before you do that, they are able to tell you how much your medications is going to cost before you even sign up at all. So their goal is transparency. They tell you how much it's going to cost before you decide. And because it's a huge discount, they don't accept insurance at this point, because they believe that the prices they are giving you is much, much less than what you would pay with your insurance, depending on all these deductible things that we have talked about already. So this is a new program that I would really encourage people to look at it and find your medication and see if this works for you. Next slide, please. The next one is Amazon Pharmacy. I'm sure each and every one of us on this line has used Amazon before and uses it. And so, did did we know that Amazon has a pharmacy? Maybe yes, maybe no. So Amazon does have a pharmacy, and it is an online pharmacy as well. And they accept insurance, so it's like a full service online pharmacy. So you go online, Amazon.com, everybody knows how to go do that. So you go there and you search for your medications, and they are also able to tell you what your co-payment is going to be if you decide to use your insurance information, or they can tell you the cash price. And Prime members get huge discounts because Prime members always have about a huge percentage, and they're saying that they give them up to 80% discounts for Prime members. So if you're a Prime member and you take medications regularly, you might want to go check it out and see you might be saving more money than you are using your insurance. So, and the medication also is shipped to your address directly after it's processed. And of course, since it's a full service pharmacy, you always have pharmacists on call that you can call them on the phone to get your questions answered. So this is another savings program there. Next slide, please. Okay, I talked about this already, and you're able to look at how much you're going to pay before you even sign up. So that's also one of the benefits of that. Next slide, please. Okay, now I wanted to talk a little bit about other ways to save. We don't talk about samples from physician offices a lot, but this could be also a very big way of savings. For instance, if the doctor writes a short-term prescription for you, you are just taking it for a very short time, your insurance doesn't cover it, and cash price is probably outrageous. This is a way to get your medications for that short-term period. When you go to the doctor's office, don't be shy to ask them if they have samples of the medications, even when they want to start you on new medications. Most doctors will actually offer the samples before they write a prescription for you. But if they don't, you can ask them, do you have samples? I want to try it. And this is something that is approved. The FDA has approved the manufacturers to provide samples to physician offices. And that's not for sale. All they can do is give it to their patients. It stays in the office, and so you are allowed to use it. When I was pregnant with my daughter, I had a lot of nausea from day one to whenever I delivered, and nothing was working. And they gave me a prescription for this new medication, Diclages, that had just come out. Of course, it was not on my insurance formulary, so they were not paying for it. I went to their pharmacy. They told me, I think it was about $600. They told me, and I
Oh,
looked at them.
wow.
Yes, I looked at them. Of course, they don't know I'm a pharmacist. I looked at them and I said, really? Okay, never mind. So I just got my prescription back, went back to my doctor's office, and they were able to provide me samples throughout my pregnancy. And I did not. So samples is a great way also. And then manufacturer's coupon, you can go to the website of any medication. Let's say you take an inhaler, right? Advil, Symbicort. These medications are very expensive. Then inhalers. You go online, advil.com, or search coupons for Advil, and the manufacturers are able to provide you coupon. This is all allowed by the FDA, and people don't know that. You can go online and get your manufacturer's coupon, take it with your prescription, go to the pharmacy, and you have huge savings, huge savings. The other way to do this, and this is a government run program for Medicare patients especially, when you go online, there are a list of companies or medications that are approved for specific discounts, especially very expensive medications. Some of the injectables that are used for autoimmune diseases or rheumatoid arthritis that cause a numb in the leg that people take usually. When you go online, Medicare.gov, you search for the drug and they have manufacturers coupons that FDA has approved that you can print out and take with your prescription to the pharmacy. This is especially for Medicare patients. And then 90-day cost savings versus 30 days, especially for generic drugs. When if it's a medication that you take every day, if you take it every day, it's beneficial to get a 90-day supply because when you add the cost of getting it every month and you add it, maybe you can do an experiment. You add it 3 times. If you get a 90-day supply, tell your doctor to write a 90-day supply for you, and you have savings that way. And also, it will save you trips to the pharmacy, which is also a form of savings. And you're able to have medication consistently because by the time you're not going to run out of the 90 days and you have another 90 days. So you always have regular supply of medications. That's another way. And then the next one is the individual component drugs versus the combo drugs. So if you have a medication, for instance, Diovan HCTZ. Diovan is blood pressure medication plus a water pill in one pill. So sometimes those combination medications may cost more than splitting the medications. The only downside is you may have to swallow two pills versus one pill, but then you're saving a lot of money. So that's another way. You get the Diovan plus the hydrochlorothiazide, which is the HCTZ, and the Diovan comes generic as well. So you get that plus, so the doctor will write two prescriptions for you versus writing one prescription that has the two medications in one. That's another way. And then of course, mail order pharmacies. A lot of the insurance plans, when you start taking maintenance medications, which is medications you take every day to manage a condition, high blood pressure, diabetes, asthma, medications you take every day, they will prefer that you use their mail order component, and that saves you money and that saves them money as well. So it's a win-win situation. So Express Scripts, CVS Caremark, Optum RX, these are all mail order pharmacies that are offered by insurance companies for their consumers, and they do 90-day supplies most of the time as well. So this a little bit of the information that you can use to save on your prescriptions. If you have any questions, you can always reach out to the host here later on if you're not able to ask your questions or anything like that. And then, if you see me in church or somewhere, you can always ask me questions as well. And these are the references that I use to get the information together. And if anybody needs the slides to be sent or anything like that, the hosts, I'm sure they can work on that as well. So
Thank you, thank you,
I will
thank you.
leave it
Thank
for
you,
you.
Dr. Marie. Let's
Yes.
see if anyone has a question, Dr. Eddie, before I ask my question. He typically will have it at the bottom. But do we have any questions for Dr. Marie?
Yeah, I have one on my phone.
Okay.
If generic drugs are not rigorously tested in clinical trials, how does the FDA determine its efficacy and safety?
Oh, they're not doing
But
okay. So that when they start, they're not doing the vigorous trials that the brand name company did, but they're still testing. They have to use that when the chemicals that they're going to use to prepare the drug has to be the same components. So definitely they are still regulating it. They're just not doing the the trials from the scratch. That's what they
From the
don't do.
clinical
But it's
trials for
the clinical
years.
trials, right? But they still regulate the manufacturing and everything. Absolutely, yes.
Okay.
yeah, to add to what you just said, mostly the processes that the manufacturing company goes through for every batch of drug that comes on the counter, same thing is done at the FDA at the bench and stored, following the same protocol that the manufacturing companies also follow to
Right.
see its efficacy. And so from there going, I mean, it's more like paperwork, paperwork, paperwork. That is why it is. I mean, just to add to what you gave.
Okay. Do you have
Right.
more questions?
Eddie.
Okay, he's probably looking. So I have a question regarding formularies because you had mentioned that the doctors may prescribe medication and may not necessarily be on their formulary. How often does formulary change?
Well,
Do
it
they change
depends.
yearly or frequently?
It, it depends on the company, because when the new drugs come out, it takes a while for the insurance companies to do their checks and balances and see, are we going to add it? Are we not going to add it? So if I can remember correctly, when I was working for the insurance company previously, it was a while, maybe when medication comes out, 6 months, 1 year, maybe more before they
Okay.
get it on formulary. Some medications, if it's an orphan drug, which is if it's the first of its kind, they may get it on formulary right away. But if there are alternates out there already, it might take a little longer before they add it.
Okay. Okay. Also, I've noticed that some physicians may prescribe brand name. They're like very particular as to whether the patient get brand versus generic. If it's the same formulary and efficacy, why are physicians so particular about one or the other?
Well, sometimes a patient preference. Of course, you want to give a patient something that they will be willing to take. So if you're not able to convince the patient enough that, okay, this generic drug is going to save you money, and the patient insists on a brand name and they can afford it, that is fine. So a lot of time it's not the physician, it's the patient that is driving that. The patient is the one that is adamant, I don't want to take generics, or maybe they may have reacted to a certain generic, and so
Mm-hmm.
they will say, okay, I don't want to take generic drugs anymore. But it doesn't mean that, oh, you may have reacted to something else in the drug. It may not necessarily, because the chemical is the same. So it may be the excipients, which is the other things that they add to get the tablets together. You
Mm-hmm.
may have reacted to that. So the patient will say, I reacted to a generic drug, so I don't want to take it anymore. So it's a patient driven, that,
Right.
not the physicians. Yeah.
And it could be a mind thing too, right? Because if you think about it,
Right.
the word generic versus brand,
Right.
everyone,
But
everyone will want a brand name, wouldn't they?
right. But while we are talking about that,
Mm-hmm.
brand and generic, when legally, when a physician writes a prescription, even though the brand name is on the prescription, so they will write Lipitor, 40 milligram, take one tablet a day. At the bottom of the prescription, there's a box. Underneath, it says DAW, and which means dispense as written. If the physician does
Mm-hmm.
not check that box, legally, the pharmacy is required to dispense a generic. And so
Okay.
the physician will, because the brand names usually are easier to spell. As we know, the generic names sometimes they sound a little crazy and it's not easy to spell. So they will write
Mm-hmm.
Lipitor on it. But by law, if they don't check that box that says DAW, then the pharmacy will have to dispense the generic unless patient says, I want the brand name. Then the doctor has to write the prescription to check the box so that, the legalities are all taken care of. So that's how that goes.
That's a good
Okay.
tip to know because not everybody would know that. They will assume whatever the physician wrote is what they're going to get.
Right.
So
Doctor
that's
wrote
very
me
good to know.
Lipitor. Why are you giving me generic? No,
Exactly.
it doesn't mean that way. Right.
Exactly.
Another question. Can prescriptions for family members who live outside the US also benefit from some of these ways to save on the cost? For example,
Hmm.
if someone has a prescription from a medical doctor in Ghana or UK.
Well, it would definitely not be accepted in the US because we have our own regulations. So what you can do is if it's a legitimate prescription that you brought from another country, you can go see a physician from here, and they will check you out, look at your history and everything. And if they agree with you, they can write a prescription, an American prescription for you, and you can use it to fill here. Let's say you are visiting or vacation or something, and you need a prescription, but it has to be a United States written prescription, not foreign.
Okay. So
So,
another
oh, go
question.
ahead.
Okay. So the question last week we asked was if somebody came to visit, how does the person access healthcare or prescription?
Well, if they are just visiting, they are visiting. They're not. The person is not a citizen here. The person is not a resident here. Um, I know with the emergency, if you go to the emergency rooms, they have certain programs that may allow foreigners to access certain financial benefits while they're in the hospital, depending on what happened to them. Like somebody visited, they had a stroke, they had this heart attack, major events happening. There are some programs that may allow the person to access some financial benefits. That's like a legal thing, and social work and care coordinators come in that. But they do have programs in the hospital. At least I know that they do.
So, a follow up question to Eddie's previous question regarding prescriptions and utilization of these coupons. I wasn't initially, I thought he meant if someone was in Ghana, could they use Good RX? Or if they're in UK, could they use Good RX? Probably not in Ghana, I'm assuming.
Right. I
I don't,
don't think it's international yet, because when
okay.
you go online, all the pharmacies that, because our regulations are different from another country. They may have a different version of that in UK. Um, but in Ghana, I'm not sure. I don't think so. I don't think so. Yeah.
Okay. So, a question about Amazon, the online pharmacy.
Mhm.
So, as you know, we all shop on Amazon and they have different variations of products for the
Mhm.
same thing. So, how is it regulated in terms of making sure that depending on, I guess, the supplier, is it just one supplier for the Amazon pharmacy? or just
So,
multiple suppliers that sell through Amazon, like other
oh, no, no,
products?
no, no. The
Okay.
pharmacy is completely different.
Okay.
This is a pharmacy that is licensed to practice as a pharmacy. So it's just like looking at a CVS or a Target, but it's online. So they follow all the regulations that retailers would follow. So it's a mail order pharmacy. So the quality of the drugs, the wholesalers that they use, everything is regulated as vigorously as they would regulate a CVS that is sitting next door to you. So it's totally different from going and shopping around there. It's totally different. This
Okay.
is a certified, regulated pharmacy that is operating by Amazon. Yes.
Okay. And also, before you came on, I kind of researched other coupons, and there were a couple, Well RX and Community Cares RX and RxRH.com. I was wondering whether if you're familiar with those three.
Right, right. You have setting the pharmacies actually have discount programs that there's one also called RX Savings. I
Hmm.
just started on the major ones, but every pharmacy has some kind of relationship with one of these discount companies that they use. So a lot of times when you go and your insurance is not covering your medication or the copay comes out very high, they actually offer you, say, oh, let me use this card and see. I don't know if people pay attention to that, but these are also ways that a pharmacy uses to help the patient as well as get business for themselves. Yeah, so there's a lot of them out there too. Yes.
Yeah. So regarding the physicians having samples, it would be nice if they actually offer it. They never do. They
My
never say,
physician does.
really.
Really.
Oh my, well, then I want any medications, but I've never, with all the physicians I've worked with, like I never hear them say, "Oh, there's this, sample that you can have." Patients typically have to be like, "Do you have a sample?" And then they would then offer.
Oh,
So I just hope if there any one of you are watching, if you have samples in your office, make sure that you do offer your patients and
they
not
do offer it.
necessarily wait
Right,
for
right.
them to ask. So let me ask Dr. Eddie again to see if we have any further questions before we let you go, because of time. But thank you so much for this great information. Dr. Eddie, you're on mute. You're still on mute. Oh. Sorry, we can hear you now.
Yeah, I don't have any questions for now.
You don't have any.
Yeah.
Did the guests have any questions? Any other viewers have questions?
No.
No, they don't have any questions. Okay. You have your fans on. Watching. So, Dr. Maureen, thank you so much, and sorry for the late start again, but this is great information, and I will personally make sure that we post it on our platform so that folks can have access to it as well. And we hope that you will be willing to come back again. I know I've been harassing you, and
Absolutely. Absolutely.
I'll only harass you because I know that this will be beneficial. We've had two other pharmacists on the program, but they also focus on a different aspect of your job, and so this certainly is something that folks are dealing with on a day-to-day basis. So we're grateful that you're able to impart on us your knowledge about this topic. So thank you, and I'm not going to hold you any longer. We look forward to you coming back very, very soon.
Very soon. I
Thanks
get it.
again.
Well,
All right.
thanks for having me. Thanks for having me.
You're
Yeah.
welcome. You're welcome. Thank you too. Have a wonderful, wonderful evening.
Thank you. Good night.
You're welcome. Good night. Okay, thank you, family. That's the idea. You coming back to say goodbye before we go, or sorry again, everyone, for starting late. We certainly appreciate Dr. Maureen for coming on and sticking with us. We hope that you do join us in 2 weeks. Our next program is April 26th with Dr. Barbara Intwa on risk factors and treatment and prevention of osteoporosis. As always, please do submit your questions and concerns to emc@youandyourhealth@gmail.com. Again, that's emc@youandyourhealth@gmail.com. We look forward to seeing you next time. Have a wonderful, wonderful evening and be safe. Thank you. Bye-bye.